Welcome everybody to the East Boston Resiliency Assembly on this Saturday, November 14th. It's very bright and sunny out there. We're very glad to have you. Thank you for taking your time on this busy day to both listen and to share ideas on climate change challenges and how we as a community might personally and collectively respond in the event of a storm-related catastrophe, though it could be COVID-related as well. My name is Phil Giffey. I work at NOAA. Very fortunate to be here. To say the least, these have not been easy days for anyone, especially in East Boston and Chelsea, where COVID has been such a scourge and remains so and will continue to be so through the winter, we're hearing. The virus has dominated our attention and claimed the lives of many of our neighbors and more to come. We've seen the toll it has exacted on our bodies and our spirits, jobs lost, rampant food insecurity, the inability to pay bills or for housing, children out of school and small businesses closed. Coupled with the recently concluded national election, these twin perils have absorbed our attention and clutched our emotions like nothing else in memory. Our attentions have of necessity been diverted to these life-threatening and socially undermining challenges. This moment hurts, and we can't even give each other a comforting hug, much less an embrace. We could perhaps virtually do that right now. Nevertheless, life does go on. With the new administration in Washington, we can begin to piece together a more effective response to this virus and the economy as well, and to the ever-present threat of climate change, which hasn't waited for any COVID or administration change. And aren't we all glad climate is finally becoming, again, a national priority? To the point, what does Resiliency Assembly actually mean? As you may know, NOAA has been hosting climate educationals that began right after Superstorm Sandy in 2012. The first one was held at the East Boston Neighborhood Health Center, from whom you'll hear later. As you know, our wonderfully diverse neighborhood is a peninsular landmass that makes East Boston and Chelsea particularly vulnerable to sea level rise events such as hurricanes, which are increasing in regularity and intensity and which cause extreme flooding, such as the two bombogenesis floods in 2018. There's no time now to talk about extreme temperature, which takes more lives than the economic damage caused by sea level rise, but that will be for another day. But let us not forget extreme temperature. Climate change dangers are not just from the sea. Former City Councilor Sal Lamantina will tell you he was surprised to find his home on Orient Heights damaged by a severe microstorm about 4 years ago. Who would have thought that Orient Heights was subject to flooding? However, the inevitable future storm surges will be worse than any intense thunderstorm. So we do need to be prepared in order to be resilient, personally and as a community. Today, we will share flood projections which East Boston might experience during future storm surges. The one we will share with you in a video shortly, later together discuss, is the 2018 bombogenesis event as if it were to occur in 2030 and no green or gray infrastructure had yet been built along Border Street or around Maverick Square. We know these surges will slice through East Boston and create pockets of isolation throughout our neighborhood. In the coming hour, the video will dramatize again for you what Central Square will look like, what happens to the tunnels, and Maverick Square, which might be spared at that particular time. In any case, why is NOAA doing this? It's a good question. After our previous climate events, residents often came up to us and says, what do I do in an emergency? Where does my family go? What happens in my school? My ability to get to work, how will I get out of here, and what should I take with me? We know that local agencies such as District 7 Police, our fire department, and of course our health center, nationally renowned health center, will respond as they always do, but few of us know what will actually happen in the case of an emergency of this magnitude. A local activist, Chris Markey, once commented that the escape route he found took him up Bennington Street, into Winthrop, into Revere Beach. That is, oncoming into rising seas, not exactly a safe harbor route to take one's family. Since we didn't have an answer to these important questions, we decided to find out what residents knew of climate change, were they prepared, and in the event of a storm surge, from whom did they receive trusted information in a bilingual way as well. So with a grant from the Robert Wood Johnson Foundation, thank you very much, and in tandem with trained health and climate researchers from New York University, our terrific youth crew and climate delegates, bilingual climate delegates, conducted a neighborhood survey last year of nearly 300 East Boston persons. Dr. David Abramson and his team from NYU analyzed all that data, and they will share that with us shortly. Let me describe some of our objectives for the day, as well as some of the participants who will lead us during the assembly. We'll start with a couple things. One, providing opportunities for community residents to learn about community preparedness, emergency preparedness, and response planning, and to be actively engaged in household and community readiness activities. Two, fostering systems thinking and collective action by posing an extreme weather climate scenario event to the attendees, that is you guys. Three, advancing climate discussions with citywide agencies such as BDPA, DMD, the Office of Emergency Management, Boston Public Health Commission, and of course, the city's Environment Department with whom we work very closely. Four, we're building the case for an all hazards East Boston Resilience Network, but much more on this and in discussions later. In order to do this well, we've gathered some very experienced people to guide us through this day, and it's my pleasure to introduce some of them now in a brief way. Our keynote speaker you'll meet shortly, Rich Serino, is a distinguished senior fellow at Harvard University's National Preparedness Leadership Initiative, and he's former deputy director of FEMA under President Obama, and some might know him as the former chief of Boston's EMS. Rich also knew East Boston and got his start here, as he will describe. Robbin, who has been our internal project manager for this initiative funded by the Robert Wood Johnson Foundation, has been serving as our resiliency officer also for several years. Robbin used to work at Massport and knows resiliency planning well. Dr. David Abramson and his able aide, Alexis Merdjanoff of NYU, who've done a spectacular job organizing all sorts of data and the details of this kind of work, will be here as well and present to you. I think of them as sort of our disaster people because they know what happened in Joplin, Missouri, Hurricane Katrina, Hurricane Maria down in Puerto Rico, and in Harvey, I think in Houston. They know what they're talking about. You'll want to hear what they have to say. They'll be followed by Dr. Jackie Fantes, Chief Medical Officer at East Boston Neighborhood Health Center, and her colleague, Dr. Micael Mancusi, Vice President and Chief Behavioral Officer of the East Boston Neighborhood Health Center, who can say enough about all the great work they've done trying to keep our neighborhood safe, clean, and moving ahead in these days of COVID. And unfortunately, much more of that to come. We need to work even more closely with them than we have in the past couple of months. I'm also delighted to welcome two essential agencies in the city, Boston's Office of Emergency Management and Boston's Public Health Commission, OEM, is represented by Mr. Ky'ron Owens, Director of Communications, and the Health Commission is represented by Nancy Smith, who is very well known in these parts and is a friend to everyone she graciously meets and is lucky enough to get a hug from. They will co-present on community and personal preparedness. I want to thank my teammates, Melinda Vega and her terrific youth crew, for their wonderful work you haven't seen yet and behind the scenes organizing for this particular event and the survey they were about to share with you. They'll be also working with Manlio Mendez, NOAA's senior organizer, who was just given an award by Representative Adrian Madro in the legislature of Massachusetts for the great work he does organizing in our neighborhood. Lastly, Dr. Paul Kirshen of UMass, who organized the storm surge video and some slides you'll be anxious to see. Paul has always been a strong and vital advocate on behalf of East Boston and a great friend of NOAA. We think of Paul as our science guy. You'll want to see what he has to share with you very shortly. It's very dramatic. I think I want to turn it over now to David Abramson, Dr. David Abramson, who is going to do a poll. David, it's back to you.
Great. Thank you so much, Phil. Good morning, everybody, and welcome. So first things first, we want to sort of get everybody warmed up and begin to figure out who's in the room. It looks like we have at least 70 people who have joined so far, and we expect people to come off and on throughout the morning. So we're going to open up a poll so we can find out who's here. So you should see a poll in front of you that asks, what sector do you represent? And I'm asking for everybody to just fill that in so we have a sense as to who's here. Community focus, by the way, could encompass a lot of different things: community residents, community advocates, community grassroots organizations, etc. And when you're done with that, you see there's a second question that asks, have you personally experienced a disaster like a hurricane, a flood, a heat wave, a blizzard, etc.? and we're going to give everybody another moment to vote. While you're voting, I want to draw your attention to the chat. There's a link to the registration there. If you haven't had a chance to register before the event, please take a moment to register. This way we can keep in touch with you. We can send you resources and follow on material after the assembly, and that would be terrific. Okay, so right now we've closed the poll. I'm going to share the results so that we can see what everybody, who everybody is, what you've said. And so the largest percentage of folks participating today are community focused, but we have a nice representation from across all the different fields, from government, education, housing and human services, and health. And 3/4 of you have experienced a disaster. So that's good to know. And I think that probably makes it even more meaningful to you. So in the next section, we're going to have Rich Serino talk to us as our plenary speaker. And Rich, as you heard from Phil, is formerly the Deputy Administrator of FEMA, as well as the Chief of Boston's EMS, and he was an Assistant Commissioner of Public Health here in Boston. He had a very long and storied career in Boston before going to Washington, and he and Director Craig Fugate at FEMA under the Obama administration promoted and developed something that they call the whole of community approach, which I think is really relevant to what we're doing here today. And Rich is going to spend a little bit of time talking to us about that. So Rich, the mic is yours.
Good morning. Pleasure to be with you, unfortunately virtually this time. But my name's Rich Serino. I'm the former Deputy Administrator at FEMA. I served under President Obama during his tenure. And prior to that, I was the Chief of Boston EMS. But to me, one of the more important things is I actually started my career as an EMT working in East Boston. So I'm very familiar with the East Boston neighborhood, from Jeffries Point to Orient Heights to Maverick Square. During my time, both in the city of Boston and also at FEMA, one of the things that I learned that's very important is how do we all come together? And when I went to FEMA, I had the opportunity to develop something that we now in many places call the whole community effort. And simply that is, how do we bring together the federal, the state, local, tribal, and territories, all the various government agencies in response, and more importantly, in preparation for disasters? Because we know disasters can hit anytime, anywhere. You know that, we know that. But how do we be prepared? And so as we started to think about whole community and all the different aspects that the governments can bring together, the federal, state, local, tribal, territories, as I mentioned, but how do we bring them together in an organized, coordinated fashion? To my surprise, growing up in Boston, when I got to the federal level, it wasn't as coordinated as I assumed. So we spent a lot of time working on that. But we also found is how do we bring together the nonprofit agencies, the Red Cross, the Salvation Army, all the different nonprofit agencies that do amazing work all over the country. But we need to coordinate. We need to come together. We need to know what each other's doing, and we need to know who each other is. So as we start to develop those relationships, then we say, who else is there? And we looked around, obviously, the private sector. We have to work with the business community, the large businesses and the small businesses, because they're the heartbeat of our communities. They understand, they work, they live there, they work there, the small businesses. The big ones provide jobs for people. East Boston, there's so many wonderful restaurants and small markets that we know and we utilize. So how do we make sure that they're prepared as well? How do we make sure that the community's prepared? And if the heartbeat sometimes is the businesses, the soul is within the faith-based community. And the faith-based community is absolutely essential to how we not only live and pray in our faith, but it's also how do we come together in a disaster? I had the opportunity throughout my time at FEMA, as well as Boston, how do people come together? And they come around together based on their faith. Who do they trust? Usually the faith-based community. Whether you go into a church, a mosque, a synagogue, people coming together. I remember when we started talking about the whole community concept that I was out in our Region 8, which was out in Utah, and visiting out in Utah, and started talking about this whole community concept. And somebody in the audience, after I made it, talked about it for about 10 minutes, said, you know, I work in a very large church, and we have thousands, actually 25,000 people who were trained in disaster response, and we have 2 warehouses and a cannery. And we want to be part of the team, but we've never been asked. I says, well, I'm asking. And ironically, about a year later, I saw him at a conference, something called BOEA, National Organization, Voluntary Organizations Active in Disaster. And after I spoke, he says, I'd like you to come over and meet the church elders, and started to talk to the church elders. And they says, would you mind getting a picture taken? And I said, sure. And as we're going over to get the picture taken, the person who I had met the year before said the church elders, because of everything we've done in the last year, they've gone to 11 different national disasters around the country. They saw what they could do and how they could help people. So the church elders gave $2 million to help continuing across the country response. I says, if I get another picture taken, I have another $2 million. That didn't happen, but moving forward. So as you start to think about bringing together the federal, state, local, tribal governments, the nonprofits, the faith-based, the private sector, and bringing all these folks together, what we call the whole community. And to me, how you're able to do that really helps in the response, but more importantly in preparedness and how to be resilient. But then there's really one group that's left out. And in that last group, to me, is the most important group. Who is it? It's you. It's the public. To me, the real first responders is the public. How do we look and make the public an asset versus a liability? How do we look at, rather than somebody a mouth to feed or a blanket to give, really making them truly the first responders? How can they have neighbors helping neighbors? We all know the elderly neighbor living down the street around the corner. Well, during a flood, a snowstorm, check on the elderly neighbor. I remember working with Mayor Menino for years, and he used to say, you know, make sure you go check on your neighbors. We took that nationally, but also down the street, next on the other side, you have a neighbor, a single parent with 3 or 4 kids. Maybe making sure that they're okay too. And then, you know, down around the corner, there's the child or a family with a child or sometimes children with functional access needs that need extra help. Make sure to look at them, how you can help them. If now you bring that all together, that is a whole community response. Taking the opportunity to understand what you're able to do, how always coming together makes a difference. Being prepared, you know, David is going to talk to you in a few minutes to give you some very important information and statistics, but you know that we're going to have disasters coming. You know that you can make a difference. You have to take the initiative to have a plan, not up to somebody else, because if you're ready, think of all those that you can help. Because when you call 911 during a disaster, they're busy. And it's going to overwhelm the system. So taking the opportunity to really be prepared, being resilient. 2 quick stories is during my time at FEMA, I had the opportunity to travel disasters all over the country, from Maine to California to all the way out to the American Samoa for tsunamis, and also to one of the worst tornado hit this country's history in Joplin, Missouri. 162 people died, thousands of injuries, 8,000 homes were destroyed, and 1,000 businesses. How that community was resilient and how they came back was really about somebody who was not elected official, not somebody who was involved in, you know, anything other than she was a very big community activist, became much bigger after this. A woman by the name of Jane Cage, who's turned into a great friend of mine. She helped rebuild Joplin. She looked at how she can do what she can do from a community point of view, what people are able to do, how they're able to do it. Working with all the federal, state, local agencies, working together with businesses, but an individual in a neighborhood that stepped up can make a huge difference. Also in Hurricane Sandy that hit New York City, I spent almost 2 months in New York City, in the area after that, New Jersey and New York. And a lot of people never thought that New York City would be without power for as long as they were. They never thought not only would they have water in their homes, they'd have sand in their basements. Not just their basements, throughout the whole house. I remember walking through homes the day after and sand up to over my knees. And I'm 6'5", so very much a lot of sand, and water had already receded. But what we saw is the communities that came together, the ones that had the relationships ahead of time, fared much better in the recovery. Because the recovery is not going to just be a few days. It's going to be weeks and months, in some cases years. But having those relationships ahead of time can make a huge difference. You can make a difference. You can make a huge difference. And that's why I was honored to be asked to speak today to where I started my career, and especially with the folks at the Scale Up Project. So thank you, have a good day, and take the opportunity to participate and meet other folks. And saying we have in the disaster world is you don't want to be exchanging business cards at the scene of a disaster. So not just exchange business cards, but get to know each other today. Thank you and good luck.
Thank you very much, Rich. This is David Abramson again. I'm going to introduce my colleague, Alexis Merdjanoff, who is a sociologist at NYU, works alongside me in our Public Health Disaster Center called PIR Squared. It stands for Population Impact, Recovery, and Resilience. And what we're going to present, what Alexis is going to present to you, is really what Rich was just talking about. What does the community look like? What does East Boston look like from the perspective of the residents, from the perspective of the organizations? How cohesive is the community? And I think you'll find it very interesting. We also drew on expertise from some of our colleagues, including Dr. Brian Mayer, a sociologist at University of Arizona, and Dr. Neha Gondal, who is at Boston University. As a reminder, for those who may be having some difficulties hearing us, under the interpretation button, if you turn it off, you should be able to hear this more clearly if you don't need the Spanish channel on. And with that, I'm going to turn it over to Alexis.
Great, thank you so much, David. Welcome, everyone. Thank you for joining us on this Saturday morning. We really appreciate having you with us. So I'm going to share my screen and go through a few slides that show our results for two key components from the Scale Up project. This will take about 10 minutes or so. And I'm going to talk about the residential survey that we did, as well as a network mapping analysis of East Boston organizations. So let's first talk about the residential survey. So the goal of our survey was to develop a snapshot of what East Boston residents think about climate change and extreme weather events, their readiness for emergencies and disasters, their sense of community and political efficacy, and opportunities for action. So we were really fortunate to work with the NOAA youth organizers to collect data for our face-to-face surveys. They worked really hard and went door to door to randomly sampled households throughout East Boston from June until November 2019. And they completed 273 surveys. We focused on these 3 zones, which you can see in the map on this slide. And these zones generally approximate 3 East Boston neighborhoods: Orient Heights, Eagle Hill, and Jeffries Point. And we picked these neighborhoods or zones based upon the 2030 flood maps from Climate Ready Boston. Since we have very limited time to review these results, I just wanted to share some really high-level findings. Of course, if you would have any questions or want further information about the residential survey, please let us know. We have a nice executive summary that goes into further detail of our results. So what are some of the key takeaways? Well, first, we had 273 respondents, and they were nearly evenly split among the 3 neighborhoods. In East Boston, people had a really high sense of community. They really liked where they lived. It was an overwhelming percentage of people who liked living in their neighborhood. A majority of respondents reported that they had lived in Boston for less than 5 years. Most were renters. And about 60% of the surveyed residents believe that climate change is affecting US weather. And we found this to be pretty encouraging because it means that we can put effort into developing solutions rather than spending time trying to convince people to really believe in the science that supports that these changes are happening. So these next 2 slides, we're going to highlight what we consider to be some opportunities for us to discuss, particularly today as we move forward with the day, but also to think about in the months and years to come. So first, a majority of East Boston residents who answered our survey had low levels of political efficacy. And by this, we mean people wanted to be involved in the political process. They thought it was really important, but they weren't quite sure how to get involved. There is a high level of trust in climate and extreme weather experts. This is also reassuring because it means if there is perhaps a hurricane warning that's issued, that people will take that seriously. Now, however, most respondents were not prepared for future disasters, despite believing it was very or somewhat likely that they would experience a flood or hurricane in the next 5 years. And if we break this down a little further, looking at those who had prepared the following items for an emergency, we see that the best that we have here are those who have a flashlight, and that's about 50% of surveyed residents. About 40% had copies of critical documents. About 28% had 2 days worth of food and water. A little less than 20% had radio and batteries available. Only 14% had a communication list, and only about 7% had an evacuation plan. So again, let's try to keep some of these findings in mind as we move throughout the day. And again, think about these as opportunities for us as we move forward with our planning. Okay, so now I'm going to transition into talking about the results from our organizational network study of East Boston. The survey was sent to about 140 civic, governmental, nonprofit, and commercial organizations who serve East Boston. And we were able to identify these potential respondent organizations with the help of NOAA, as well as some publicly available data sets. Again, if you have any questions as I go throughout these slides, please feel free to enter them into the chat box. And just a little bit more information about the survey itself. It took about 20 minutes. We asked respondents, representatives of these organizations about the extent and strength of their organizational ties with one another. We had 40 organizations complete the survey, and their responses represent about 132 total organizations who appear in our analyses. And I want to highlight that while we have a 40% response rate, which is really good, we still consider these analyses to be preliminary, and we're still digging into them. Okay, so I like to joke that this looks like a complicated game of Twister. It's not. This is what a network an analysis map looks like. And what network analysis helps us do is model real-world systems. It allows us to see which organizations might play central roles, in this case, in the East Boston community. And you'll notice in the bottom right-hand corner that we have a legend there, where these blue circles or nodes represent government and political organizations. Red represent educational. Orange represents housing and social services. Pink is health, and yellow are community focus groups. And we have a few key takeaways with this figure. First, you'll notice this is a really dense network, okay? It has really high reciprocity. And this means that those who filled out the survey, that 6 out of the 10 ties that they named were named back. Okay, so we have a lot of reciprocity between organizations. Now, let's also look at the center of the network here. And what we see are quite a few blue circles that are centrally located, blue nodes. And what this suggests is that the governmental and political organizations, they play a pretty central role across East Boston. Now, we also asked organizations to answer questions about the types of exchanges that they had with the organizations that they named. And here's a figure that shows the central brokers in transactional networks. And by transactional ties, what we're trying to get at is, whether organizations coordinated efforts with one another, if they share resources, and if they share information. So I want you to take just a quick second and think about who these nodes might be. Now, you obviously don't know who answered our survey, but you know the community well. So who might you think plays a key role in the community in terms of sharing information, sharing resources when it comes to different organizations? And now we're going to show you who those folks are. So you'll see BPDA, Representative Adrian Madaro, East Boston Main Streets, and Boston Neighborhood Services East Boston are the central government and political organizations. You see the East Boston YMCA also plays a central role, and it's also the only central educational node that we had among our survey respondents. Now, what I want you to focus your attention on are the community focus groups, those yellow nodes, and how so many stand out as central brokers. However, you'll see that they're kind of on the periphery of those central brokers, right? And what we think is that there's an opportunity here to give community focus groups a real boost. They seem really well positioned to play an even bigger role, especially when we start to think about climate resilience and how organizations can help facilitate the community resilience of East Boston when it comes to climate change. And just to wrap up a little bit here, what we did here was break out the transitional networks by sector. And the key takeaway here is that different organizations organize themselves in different ways. And you'll see here that some of these sectors are highly centralized, meaning that we have a couple of nodes right at the center there that play a key role in facilitating sharing of resources and information with other organizations. And then we have others that are more diffuse. And to break this down a little further again, we see this hub and spoke model network characteristic for the government and political sector. And here what we see are a few key organizations at the center who play a large role tying together the entire network. And if we compare this to the housing and social services sector, which is a little bit more distributed, we can think, what are the pros and cons of having a well-balanced network? Well, maybe having a well-balanced network can help us with the sharing of information and resources rather than it having fall on a select few. And so as we move forward, we want to think about how can we best organize the resources throughout different sectors so that we might be able to best mitigate the effects of climate change. And that's all I have. So thank you so much. I'm going to turn it back over to Phil at this point.
Thank you, Alexis. Very interesting presentation. I think we'd like to have some more surveys come in, and we know not everybody was on there that we thought would be there, but it's a different way of looking at the world. The reason I'm wearing my mask is I didn't want to be chastised by Jackie or Michael by saying, we have a COVID going on out there. You have to wear a mask in public. So even though we're not in public, I'm doing an advertising for masking, and so we can keep our community safe and whatnot. And Jackie and Michael will certainly tell us why, about partnerships. So I think getting back to what Rich was saying earlier, they're a major focal point. They have information, they share it with people, they connect partnerships, and they have lots of relationships with lots of different people. So with that, Jackie and Michael, thank you very much for taking the time today. And I guess Josh will turn you off or I'll turn you on.
Good morning, and thank you, Phil, for the introductions. And thank you for wearing your mask, and I'm sure observing social distancing and conducting good hand washing and all those things that we're meant to do. We look forward to telling you a little bit about the East Boston Neighborhood Health Center and more importantly, about our response to the pandemic with our community partners. Thank you for the introductions. I'll give a brief overview of the Health Center. We're a large and complex organization. So for those of you who know us, and for those of you who don't, we'd like you to just see a little bit of the scope and size of the organization and what we do in the community. And then my good colleague and friend, Dr. Jackie Fantes, our Chief Medical Officer, will take us through our response to COVID with our community partners. And if there's time for questions, great, but that can happen, I'm sure, throughout the day. So we are a large and complex organization, but we want to keep ourselves focused and grounded at all times. We've been in the community for 50 years now. We really take that logo seriously, where it says all are welcome. And that message will be found on all the points of entry throughout the organization and its many buildings. So our mission is to provide easily accessible, high quality, safe healthcare to all who live and work in East Boston and the surrounding communities without regard to age, income, insurance status, language, culture, race, ethnicity, or social circumstances, regardless of ability to pay. It's a very serious intent on our part. All are welcome at all times. We are 24/7. So just to give you some information about the community that we serve. So we're a major provider of care. We, over the years, because of the geographic isolation of the community, have grown in leaps and bounds. Our community comes to us for everything. Our community pushes us to grow in service to their particular needs. As you can see, we service a diverse low-income community. 71% live below the 200% of the federal poverty level. That's quite a statistic. 65% are served best in a language other than English. Therefore, we have a large interpreter services department. And then you can see our market penetration rates. East Boston, 73% to 75% of the residents of East Boston come to us for their care. In Chelsea, it's 37 to 40%. Revere, around 30%. Winthrop, and growing, around 27%. And we now consider Everett in our Crew area communities. And just to note, this past July, we had the absolute good fortune of adding the South End Community Health Center to the health center. We merged. And so we now see over 100,000 patients. And it's upwards, to 115,000 or so, over and across 300,000 visits or more a year. And with the merger with the South End, we have over 1,200 employees. So this is the array of services that you would find at the health center. We have a very, very large and complex primary care department featuring adult medicine, family medicine, and pediatrics. And they're the equivalents of those departments at the South End Community Health Center as well, which provides a lot of primary care. OBGYN women's health in both locations. We have an integrated behavioral health care model, which we're very proud of. So our behavioral health clinicians, now with the South End in mind, we have over 40 behavioral health clinicians throughout the health center. They're all integrated into primary care, where they serve the patients along with the primary care team in a very much integrated way. We have a dental service in both locations. We're one of the few community health centers, federally qualified health centers in the nation, that has its own emergency department, which is quite a cornerstone for our community. And we've been operating 24/7, 365 since we opened 50 years ago. We also have HIV services. We have addiction services in both locations and over 300 patients that we serve. Again, a large interpreter services department, lab, pharmacy, radiology, a number of specialties, vision and dental, nutrition in both locations. We have the Student Wellness Center at the East Boston High School that's gone virtual right now, but an integrated program in the high school, and 3 other school-based health programs through the South End. We provide vast amount of care navigation services to serve our patients through the Community Resource and Wellness Center, which has become really a food distribution center under COVID-19. And we also have, with the acquisition of the South End Community Health Center specialty or long-term behavioral health. So a continuum of care for our patients. So this is our strategic plan, which sadly is coming to an end. This was 2020 vision, but the goals below have not and will never come to an end. And I just call your attention to, we're re-upping our strategic plan. It's reimagining 2025, and it's in development. And I would say one of the silver linings, if there could be any, to COVID-19 is lessons learned, tailoring care in this world of telemedicine, telehealth, which we had to rapidly switch over to. And in behavioral health, we're up over 90% delivery of telehealth, telepsychiatry, and up 60% or better in medicine. These were our strategic and are our strategic goals. Quality. We want to improve the quality of the health of our patients, but really everybody in the community we serve, every individual and family. We want to be an efficient care delivery system, and growth is always something that we're doing, and we've always been pushed to grow, as I said, by the community. The only difference is we now want to make sure that it's sustainable growth. And then we have a one company vision. So I'll just end here with our vision statement, which is working together to make our neighbors healthy. And I turn it over to Dr. Fantes.
Good morning. Phil, I greatly appreciate your advertisement for good mask wearing and social distancing. As I move into our response to COVID, that's the perfect segue into our response as the health center and teaming up with our community. As Micael talked about, is what we do at the health center. Our mission statement, thinking about everything that we provide for the community. We have an over 70% penetration into East Boston. And so we had a very vast response to COVID, which we feel is a good example of how do you respond to a disaster in East Boston. We have a command center at the health center, and so we very quickly stood that up. Our senior team came together in daily huddles, sometimes more than daily. We kept everybody, a multitude of things to keep all of our health center, our over 1,200 employees at the health center. We need to keep them informed. And we did that through weekly managers meetings, multiple town halls with all staff, meeting with community partners, Boston Public Health Commission and the City of Boston in particular, to disseminate ways to stop the spread in our community. And development of a COVID-19 SharePoint site so that we could post all of our dashboards and other items to keep people educated about the COVID pandemic. The most important part of this slide, this just showed all the points that we had to address with each of our senior management meetings to make sure that everything was coming together, all the way from governance within the health center, all the way down to the community. We needed to make sure that we were alongside our community partners to make sure that we had a good response to this terrible pandemic. So we did a lot of things. We knew that, on March 13th was a big day, I think, for a lot of people. We were notified that we needed to stop all routine services and decrease the foot traffic in our health center. However, being a big provider of health, the major provider of healthcare in East Boston, we knew we had to keep our doors open, but do it in a very safe way and provide the best medical care that we could in this time of crisis. And so we centralized our direct patient care services to 2 main buildings. And we did that because if everybody remembers, back in March, April, May timeframe, personal protective equipment was very short. And we had to conserve that, and also conserve our staffing. We didn't know what was going to happen with our staffing, the same as in the community. All of our staff live in the community, and we had to prepare for illness within our staffing. And so we, being a large health center with 2 main buildings, we could provide safe COVID care in one of our buildings and safe well care and the routine care that needed to continue in the other building. One of our major setups was our influenza-like illness clinic. That was, we strategically located that just exactly next door to our emergency department. Our primary care providers were not providing the routine care that they had. So we had the ability to staff our influenza-like illness clinic, and that was for 2 reasons. Was to be able to keep those that were potentially infected or infected with COVID in an isolated place, and provide the good care for them, and conserve our personal protective equipment, and keep only a few of our staff seeing those patients so that we could conserve the PPE. In our emergency department, we set up both hot and cold areas. That was very important in order to be able to continue to care for folks that did not have COVID or COVID symptoms in our cold area to keep them safe. Well, child care and OB care had to continue. Our 20 Maverick site was considered our cold building where we could continue well child care. One of the things that we take great pride in at the health center is our immunization rates of our children, and take that very seriously. And one of the worries about the pandemic was that we would not get our children immunized and exchange one pandemic for another pandemic or epidemic. And so we needed to keep our well child care and immunizations going for our children, and to do that safely. And also our prenatal patients, pregnancies progress even in a pandemic, and we needed to do that safely. We had to reassign staff. Our staff were more than fantastic. And they knew that sometimes their jobs needed to be reassigned. We had some, specifically a couple new jobs in the health center, lobby screeners, where we screen every person coming into the health center. And then we had a robust testing response, which I'll talk about a little bit later, and we had to staff those testing sites. We have a community resource and wellness center at the old library that greatly expanded its food distribution for the community in partnership with the Red Cross. We had immediate implementation of telehealth. We had been talking about telehealth for a long time, and like I always say, in like 10 minutes, we stood it up, as well as many other healthcare systems, and that has been a huge way that we could continue to care for our community in a very safe way, and address the needs of our high-risk population, and of course, chronic disease management. We had exponential growth of our behavioral health visits. Behavioral health visits needed to continue because of the pandemic. We also did a mobile van for immunizations. We created registries to track our most vulnerable populations. We provided care packages to thousands of patients. We had our testing was set up. We partnered with Boston Public Health Commission and the city of Boston, and set up initially for first responders, then city workers, and then all community members. Contact tracing and testing ambassadors program with the Mass League and Partners in Health to do all the contact tracing of our positive test. Community education for quarantining challenges for an immigrant patient population, overburdened by positive rates. East Boston was very overburdened by positive rates, especially in April and May timeframe. And we had to overcome the fears about testing. We did this with education through social media, teaming up with local politicians, local community online forums to include Spanish language media. We did several testing sites. We did our campus division, and we have ramped that up and are doing about 350 to 400 tests per day, currently at our 79 Paris location. We did mobile testing. We have a mobile van, and we have gone we've used a geo mapping tool to be able to find testing deserts in the neighborhood and bring the mobile testing to them. And we have teamed up with the city of Boston for citywide testing and have toured around the city, providing 300 to 500 tests per day in the community. This is just an example of the number of tests that we have been providing. We've been doing 2,000 to 3,000 tests per week for a very long time. And we track very closely. We have everything within our electronic health record, and we track very closely the positivity rate in our communities, as well as in our symptomatic patients and asymptomatic patients. And this is very important also in the, so now that we've progressed to fall timeframe, we've been anticipating a dual issue of influenza and COVID this winter. It's very important that all of our staff and community are vaccinated for influenza to protect each other. This year, like I said, is compounded by the COVID pandemic. The symptoms are very similar. If we can mitigate influenza as much as possible, it would help us in our response to COVID. Therefore, we established, we had a very robust flu campaign. We've always have a flu campaign every year. And this year, very robust. And we, for our employees in particular, we usually try to get a 90% compliance by December 1st, but we wanted to speed that up and get a 90% compliance by the 31st of October. And we did that. So we are very happy that our employees are immunized against influenza. In addition, we've given over 16,000 influenza vaccines to the community. And in addition, we offer flu shots at our testing site, which has helped with community influenza vaccination. So this was a very important process to include in our COVID response. So that has been our COVID response. And and I'll be happy to answer any questions. Thank you very much for your time.
Thank you very much. And Michael, thank you very much for that significant presentation. We know you've done fabulous work under extraordinary circumstances in a rapid manner. We couldn't do it without you. So, Jake, I couldn't put a needle in my arm to show that I got a vaccination, but I have done that already elsewhere. So I've got my stuff here ready to go, social distancing. Thank you both for a fantastic presentation. I'd like now to introduce Mr. Ky'ron Owens of the Boston's Office of Emergency Management, and then Nancy Smith. I haven't really met Ky'ron directly, but you're very welcome. I know you've been talking with Robbin for months and months and months on this, Ky'ron, and you've been very open and generous with your time. So I really want to thank you and welcome you to this event. You'll have a lot to share. You're really connected to the city in different ways that we're not, and maybe the health center isn't. And we know you have a great partner in the Public Health Commission as well. So please present. Welcome. Thank you.
Definitely. Thank you, Phil, and thank you all who are on the call. Thank you, Noah, for allowing myself and Nancy Smith from the Boston Public Health Commission to present. I also would like to acknowledge that we have our Deputy Chief of Operations from the Office of Emergency Management, Dennis Rorie, on the call, so I know he's also pleased to have the opportunity to be here. And we're excited to hear, about the findings. And thank you all for your support and trying to make sure that we combat and fight against COVID-19. Continue pushing to your networks. All of the guidelines that have been coming out around social distancing, always wearing a mask in public, and making sure that you're washing your hands and frequently sanitizing frequently touch surfaces. So without further ado, Nancy, I want to pass off to you to allow you to introduce yourself, and then I think Deputy Rorie as well. And then if we can get started with the presentation, I think that'd be great.
Hi, everyone. My name is Nancy Smith. I'm with the Boston Public Health Commission, and I'm in a bureau that's called the Office of Public Health Preparedness. I won't go into the details because a lot of people actually say, didn't even know we had an Office of Public Health Preparedness, but I have spent a lot of my early moments with this department in East Boston, thanks to Dr. Atia Martin back in 2012. And meet Noah and many activists, Robbin at that time. And so I've actually learned so much about East Boston because Dr. Martin said, you've got to go over there and learn East Boston because of the climate change that's happening very rapidly. And then this past, I think it was in April, I had a wonderful opportunity to meet the folks at East Boston. I actually participated with them on a COVID event that happened in Roxbury. And the first thing I told Mike was that I was so impressed because they showed up with their emergency preparedness vests and stuff. So I'm going to pass this back on to Ky'ron, and we'll be talking later on about the things that we've been doing in East Boston and around the city of Boston.
Okay. And then lastly, I just wanted to give a chance for Deputy Chief Dennis Rorie just to say hello quickly. I think he can hear us. We can't hear him though. So I'm not sure. Maybe it could be the headphones. I'm not sure.
We have to move ahead.
Okay. So I guess we'll just get started with the presentation. So if we want to pull that up, and then we'll move forward. So once again, I represent the Office of Emergency Management, who is led by our Chief, Shumaine Benford. And then also co-presenting with me is Nancy Smith from the Office of Public Health Preparedness. So first, we'll get started. I'll tell you guys a little bit about the Office of Emergency Management, and then Nancy will dive into a little bit about the Office of Public Health Preparedness. So the Office of Emergency Management, or as we call it, OEM, is we have a mission to enhance Boston's capacity to protect against, prevent, prepare for, mitigate, respond to, and recover from all emergencies, regardless of scope and scale. So we have a dual mandate in the Office of Emergency Management. We are obviously the the City of Boston's primary emergency management agency and coordinating department, as well as the Homeland Security lead, administrative lead. In addition to that, we are also the fiduciary for the Metro Boston Homeland Security region, which is made up of 9 cities and towns surrounding the Boston area, including Boston, to make up, like I said, the Metro Boston Homeland Security region, which is how we attain the Urban Areas and Security Initiative grant, which comes out of the Department of Homeland Security and really funds a lot of our initiatives and being able to prepare for, mitigate, respond to, and recover from all emergencies impacting the city. Lastly, we're a part of the Joint Chiefs of Public Safety Cabinet for the city, which includes the police commissioner, the fire commissioner, the EMS chief, and then also our chief of OEM. So as I mentioned, the Metro Boston Homeland Security region includes not only Boston, but Brookline, Cambridge, Chelsea, Everett, Quincy, Revere, Somerville, and Winthrop. And this really is attributed to that working together as one, because we know that if a major emergency hits the city of Boston, more than likely is going to hit these other areas too. And so it's better if we work under that community model as a region. So under the Metro Boston Homeland Security region, we have to identify goal areas, which is how we're able to get allocated UASI funds, that Urban Area Security Initiative grant. And so some of the goal areas are, you'll see on the screen, are safety and security, critical infrastructure protection, intelligence and information sharing, interoperable communications, chemical, biological, radiological, nuclear and explosion response, medical surge, planning community preparedness, like what we're doing today, recovery and cybersecurity, which we all know is huge due to like what we saw with the election and a lot of the reports that were coming out about that. So the major responsibilities to develop and maintain emergency plans, whether that's related to specific weather events, i.e. If you think of a snow emergency, a heat emergency, or extreme flooding, or it could be, a specialized response that required sheltering or evacuation. Logistics, we have equipment to support different emergency response functions and special events. If you've driven around the city, especially during the COVID-19 pandemic, we've had VMS boards around the city, which have been pushing COVID-19 messaging. We had some stuff around the election and other pertinent information to our residents. We have backup generators, light towers, and such, because you never know what you may need when responding to an emergency event. We also have our Emergency Operations Center, which is located in Roxbury, and that's really the hub for information sharing. We're always trying to do emergency preparedness within the community, because as Rich said earlier, a lot of times if there was a major emergency, your neighbors, the people who live right around you, are going to be the first responders. And then we also do public information. So our Emergency Operations Center, as I said, is the hub for information sharing. We're communicating and information that's collected from the field across departments. This is how we also are able to quickly and efficiently do resource dispatching and tracking, as well as briefing city leadership during an emergency event. So emergency preparedness, we have web-based resources on boston.gov/emergency. That is our homepage. We also have our citywide community preparedness initiative, which is Ready Boston. And part of that is participating in events like this one, where we're able to promote how you can be prepared. And then we also have resources around where our emergency shelter locations are and hurricane evacuation zones on our webpage. So Ready Boston was really framed after the FEMA's Ready America initiative, and really focuses on an all hazards approach. So with that, we have 3 pillars that we really like to promote for emergency preparedness, which is making sure that you have an emergency plan and that you go over that with your family members. We want to make sure that you have an emergency kit. And we also want to make sure that you're signed up for alerts. So really quickly, just so you know, having a kit or go bag is essential, and there is a difference. With the household emergency kit, that's really something that you're preparing so that if you had the shelter in place, you're able to survive and maintain. A go bag is really if you had to leave your house or your premise, you would still have all of the pertinent and major important items that you would need to be able to survive, i.e. it could be important documents, medication, hygiene, equipment and supplies and things of the such. And then I'll pass it over to Nancy.
Really nice about having this opportunity to have us present is that we present in the community all the time. One of the things that Ky'ron mentioned was the Homeland Security. The program that you're looking at, Get Ready, Be Safe, Stay Healthy, we have two programs. One is actually for Boston specific, and the other program is to support those other metro region cities that Ky'ron mentioned earlier. The Boston Public Health Commission has a vision that provides resiliency throughout the whole entire city. We are here to support all folks with all types of emergencies. This integrated public health and healthcare system makes sure that the community will fare better after emergencies and make sure that an equitable land is always provided with human services during and after an emergency. Some of the programming that started here was in 2012, the Office of Public Health Preparedness did not have this community engagement group. Under the tutelage of Dr. Tia Martin, looking at the need for that whole community that Rich Serino spoke about, this program was created. And through that program, Get Ready, Be Safe, Stay Healthy was designed. So you're looking at some of the most important things that the pillars of our program is get ready, be safe, and stay healthy. And along with that, this program has grown by leaps and bounds by being able to support other programs throughout different industries. And some of the things that, some of the most recent one was just actually for a particular clinic that will be held for individuals that are getting eviction. One of the items that at the top that you see is a document holder, which we mentioned that earlier. And this document holder has actually been used globally. And I'm just going to just do a quick shout out real quick to some of the places that is actually provided services under. During Maria, this particular document holder was sent to St. Croix to help with documents with the animals being shipped out. And another part, well, that was actually St. John. And then in St. Croix, it was actually used with mothers putting their documents in for their children and their own paperwork. And then in the Bahamas, during Hurricane Dorian, it was used with the Haitian community in order for them to organize their documents. So locally and globally, that document holder has been traveling all around the world. So the information I'm providing right now with the 20,000 residents over the last 5 years, this is actually larger than that. What we have is 45 trainers that have been trained. And I want to actually do a real big shout out to two of our really big trainers that you guys have right here in East Boston is Magdalena Ali from Harbor Keepers and Chris Monkey. They were one of the first trainers in 2014, and they're still out there doing amazing work over here. And I just really wanted to give them a shout out. So our program is very unique, that is actually in 14 different languages, and it's also in Braille and also MP3. So today, if you need to have this in Spanish or in any other language, you can just actually go onto our site and you can click down and get this document, which is great. And it's made it so accessible for everyone. So one of the things that we've talked about getting ready, being safe, and staying healthy is the end product is actually folks taking the pledge. And we're going to talk a little bit more about taking those pledges later, because I know that Phil said that we're running out of time. And so I'm going to just move a little ahead. One of the factors of getting ready is to be informed. And being informed means making a plan, building a kit, and getting involved. And what we're going to do is actually going to turn this back over to Ky'ron, where he's going to talk to you about what it is to be informed and looking at that amazing program that they have called Alert Boston. Thank you.
So as we mentioned, one of the main pillars to being prepared after you've made your emergency plan and you built your kit is being informed, right? Being aware of when an emergency is happening and what steps you should be taking. And so our office has Alert Boston, which is the city's mass notification system. So in the event of a major emergency, you can be notified by phone call, email, or text. That is supported by the 11 languages that are predominantly spoken in the city of Boston. And in order to do that, you can go to boston.gov/emergency. Or if you want, you can do it through text message on your phone. If you open up your text messages and you create a new message and you type in the phone number 888-777, that's 888-777, and you send in the subject line the word Alert Boston as one word, that will automatically sign you up to be able to receive text alerts from the city whenever there's a major emergency. This is just an example of if folks want to sign up through a text message, it's just a repeat of what I said. And then I'll pass it back over to Nancy.
As you can see, the kit behind me has many pictures of the items that you would actually look at, some of the things that you would put in your own kit. You're actually going to be receiving a resource sheet that will actually tell a little bit more about how you can put your kit together. And so your kit should be made uniquely for you and your needs. And it actually explains more about that. And you'll get that in the resource paperwork. And you'll see the kit. The list is a list. You guys are going to get a resource that Noah's going to send out with all of this information. Getting involved is actually what you're doing also today, but we do have opportunities of people so that you can volunteer. And if you can't volunteer for the Boston Public Health Commission Reserve Court, please try to get involved with some of the other organizations in emergency preparedness. There's Red Cross volunteering. There's all types of volunteering that's going on. Being safe. We are just basically, I'm just going to run through these 4 pillars across the top. I'm not going to explain them just because of the time frame, but understanding your surroundings is one of probably the most important things that you need to do during an emergency, and paying very close attention to the information that's going to be provided by those that are assisting you, and making sure that you stay safe. Keeping your food and water safe is very important. Learning a basic health skills. There's CPR classes that have been offered in East Boston. And I know that there's actually some upcoming virtual classes that they're looking into, which we will definitely make sure you guys get information on that. And also car safety. If you do have a car, making sure that you have actually primed it for the winter months. This is probably one of the biggest pieces of the Boston Public Health Commission program. Public health and staying healthy is probably one of the best things that you can do for yourself before and during and after an emergency. Taking control of your everyday health is one of the best things that you can do in order to prepare for any situation, such as even with the pandemic, is what you're doing now. People need to actually congratulate themselves on being able to be resilient during this period of time that none of us knew was going to happen. And these communities have actually jumped up and done amazing work, but you have actually put the E in emergency that made it successful. And Ky'ron, I'm going to pass it off to you so we can close it out.
Yep, thank you.
Sorry, guys.
Thank you. So once again, part of being informed is, social media is one of the tools that we have at our disposal in addition to our website. So we encourage you to follow us on Twitter, Facebook, Instagram, Nextdoor. And our handle for Twitter is @AlertBoston. For Instagram, it's @BostonOEM. And then Facebook is City of Boston Office of Emergency Management, and it's the same for next door. Normally when you follow us on social media, we also do try to use colors as a way to signify kind of emergency status. So whenever you see this blue hue with a post, it's normally an awareness post. There's no threatening emergency, but we do want you to be aware of the steps you should be taking and how you can be prepared. Red is really for when we hit that emergency state. This is telling you about the actions that you should be taking. So please just be aware of that we also do try to use that as a way to signify our status. And as we close out, I want to thank you on behalf of the Office of Emergency Management. I would also add that when you're making your emergency kit or your go bag, please remember to include any of your important documents. That could be, health information, bank statements, insurance papers, identification, all that kind of stuff. And really go to boston.gov/emergency to get that full list of things and supplies that you have. As Nancy mentioned, it will have to be unique to you. Everybody has a little bit different needs, but at least that general list will be a good way to get you started. And thank you.
Well, thank you so much, Ky'ron and Nancy and Deputy Rorie. We really appreciate your presentation and being with us today. I just want to remind everybody that if you please register for the assembly today, that's how you will receive the OEM BPHC resource list that Nancy mentioned. So make sure that you registered. And now we're going to hear from you all again and want to bring up some polling questions. Okay, so we have 2 questions here. So the first one is, do you have the key elements of disaster preparedness, including an evacuation plan, radio and batteries, and a flashlight? So we'll give ourselves a few moments to fill this out. And then if you could also answer the second question, how likely are you to experience an extreme weather event in the next 5 years? What do you think? Okay, I think that most folks have voted. This is pretty encouraging, I think. We have about 67, high 60s % who have 1 or 2 of these items. About 30% have all 3, which is great. But clearly, check out that resource list and see where we can continue to add to our preparedness. And it also looks like most of you think that we will experience an extreme weather event in East Boston in the next 5 years. So all the more reason to make sure that we are prepared. Okay, so thanks for participating. I'm going to turn it over to Robbin at this point. Robbin Peach, take it away.
Great, thank you. Well, I do realize we're running a little late. So in the interest of time, I will make my introduction to the youth organizers, better known as NOYO, very short. I could go on for a half hour bragging about them, but I won't do that. NOYO is a cohort of local teenagers, 14 to 17, and this particular group that you're going to meet in just a minute took a 12-class curriculum on leadership development around climate change. And it was a very intense class. It happened in December, where they learned climate science, how to become resilient. They learned communication skills and how to analyze information and communication so that they could be better change agents in their community. Resilience-oriented thinking was the goal of this particular curriculum. And you will see in the video that they've produced that I think they did a great job. And again, I would like to reiterate what Alexis has said about registering if you haven't, because we will send you not only the video that the youth have done, but a wonderful booklet that they created after their Leadership Institute. So I give you the youth.
Hi, this is Carolina, the senior youth organizer. I'm here just to introduce the youth that are going to be in the video and the youth that we have in our group right now, which is Clady, Micael, Marilyn, Melanie, Josue, and Gabriel. We really hope you enjoy the video and see what we learned throughout the Leadership Institute. Thank you. Hope you enjoy.
Hello, my name is Gabriel Roman, and I'm a NOAA youth organizer. Our mission is to empower and build strong relationships with the East Boston community. We were taught how to be leaders and how to be prepared during challenging situations. Boston is a vulnerable city when it comes to climate change. Because of East Boston's exposed land, we are more at risk if this were to happen. That's why we need to develop a strong bond and leadership within our community to prevent disaster.
Hi, my name is Carolina. I'm a senior youth organizer at NOAA, and I'm here to talk about our 9-course curriculum. So in our 9-course curriculum, we talked a lot about adaptive leadership and systems thinking. In our adaptive leadership, we talked about you should be a leader with or without formal authority, or you should be someone that is able to encourage people to confront their challenges. For systems thinking, we talked a lot about how a leader should be one that has enough emotional capacity to handle and be able to be patient or calm when situations go on, or someone who is able to understand technical issues.
Hi, my name is Micael and I am a NOAA youth organizer. What we've learned is that we must heavily decrease global GHG emissions by 2050 to prevent extreme damage that could be done to our human and natural systems. The best we can do is slow down climate change but not completely reverse it. We must all acknowledge that all of our systems are connected. Climate change is a people-based movement that helps people advocate for a better environment. What that looks like in our community is a healthier and safer space for all of us, not a luxurious national park. The takeaway from this is social justice helps fight for all people's civil rights. What the youth have learned is that the least vulnerable segments of the population that have least received GHG will later face the climate change related impacts.
Hi, I'm Clady. I'm a youth organizer, and another way to be resilient is to be a prepared community. In an activity with Ky'ron Owens, we made a 4-step plan. 1 was to create and practice an emergency plan for your family. 2 was to create an emergency kit for your family that would last you 3 days. 3rd was to create a pet safety plan in order for your pets to stay safe. And 4 was to sign up for the emergency Boston notifications. Another activity we held was the Advocacy Skill Training Program. This program trained skills like community organizing, speaking, and writing. Our goal as youth was to reflect on our motivations in order to seek positive change. We ended off expressing our voices in a capstone project. These projects looked very different, from going from a letter to the editor, an interview with the local ZoomX radio, making flyers for the community assembly, and making signs for the State House rally. These are all very fun ways in order to express our voices.
Hello, my name is Melanie. I'm part of the NOAA Youth Organizers, and today I'm going to talk about the January Educating and Favorite Leadership Institute. In the January Educating, NOAA Youth Organizers engaged 35 for the youth from East Boston and Chelsea. Activities from the Youth Climate Leadership Academy were implemented, and youth practiced public speaking about climate change. After they reported, they felt more confident talking about climate change in public. The February Leadership Institute youth engaged in conversations about climate change, climate justice, environmental justice, and more. They participated in an activity that teaches them about environmental justice, where they were divided into 3 communities, some with more benefits than others. After, they talked about what they learned in the activity and how they see similarities in real life.
Okay, well, I hope you're as impressed as I was. These are our future leaders, and I think East Boston will be in good hands. So that's it. David? I think we're going to be taking a break, but
Everybody, no, thank you, Robbin. And yes, we are. We're going to take a 5-minute break. We're running a little bit behind schedule now. These have been terrific presentations. I think we can be very cheered by knowing that the next generation at least has a good vision of how to respond. And in fact, I think some of the lessons that they had learned are things that we're going to talk about in the next section. We're going to have a presentation from Paul Kirshen. We're going to take a look at what it looks like when East Boston drowns. And we're going to think about how we're going to be able to handle that as a community. So we're going to take 5 minutes. We'll come back at 11:13. We'll see you then. Thank you.
Thank you, Joshua, and thank you for sharing that video. I think we're about to do it again, actually, and then talk about what might happen to prevent it. That's a scene you don't want to see. So what we're trying to talk about today is, in the map behind me, we do not want to see this in 2030. It's 10 years away, but one doesn't build on the waterfront or build the kind of things that need to prevent this kind of accident from happening. So let's get together and make that happen. I think I'm about to introduce Dr. Paul Kirshen, who is, I said, our science guy and our water guy, who's pulled a lot of these videos and data together to share with us today and in the past couple of years and going forward. So Paul is a professor at UMass, a terrific guy. I think I'm teeing up Paul Kirshen right now. We just had a little technical glitch in between, but we want to gain some time. So Paul, I think you're on. You're very much welcome, and take it from there. And after that, Dr. David Abramson will lead us through a significant tabletop exercise. I'll let David introduce that piece. Paul Kirshen, take it away.
Good morning, everybody. It's great you've turned out this morning. I'm going to talk a little bit about present and future coastal flooding in East Boston, and then we're going to look at that video again to really see what it might look like if East Boston had a major flood sometime in 2030. Also, that flood could actually occur today. We had a really, really extreme event like Sandy hitting us at full force and at high tide. So as I'm sure most of you remember, the bad storms we had in early in January and March of 2018, the so-called bombogenesis storms. So these are some images of these storms. So first one shows the flooding in January at the Portside East Pier condos, and then some flooding on Lewis Street near the Greenway. These are from March. And so this is at Maverick Square looking downtown across to downtown Boston. And the one on the right shows the flooding in the Shaw's parking lot. And as you know, Shaw's is the only supermarket in East Boston. And as many of you know, and as most of you believe, climate change is occurring in globally. And in Boston, we could see as much as 7 feet of sea level rise by end of the century. So what could this flooding look like? Well, in this image here, in the dark green or dark grayish color, like the color of the East Boston Greenway, that's the amount of flooding you'd see. That's the extent of the flooding you would see if a storm like the bombogenesis storms struck today. Put all the colors together, that shows the flooding we might see near the end of the century. So essentially you see, because of sea level rise, most of East Boston would be flooded if we had a major storm like the storms we had in last January and March of 2018. Now, this shows in a little more detail the flooding we might see if we had a sort of a major storm in around 2030 or so, with a little bit of sea level rise, or perhaps the flooding we might get with a very, very large storm like Sandy hitting us at full force today. And you can see the flood waters would come in, around Liberty Plaza, come in around Lower Border Street, flood into the neighborhood there, then eventually go into the tunnels. Now you can see in the lower left that with this storm, essentially a lot of the area around Maverick Square is not flooded. But Maverick Square would be, certainly surrounded by water. And you can notice that the head house, well, if that water was only like a foot or so higher, the water would go into the head house and flood out the Maverick station. And what you're going to see here is, again, a storm that may occur now if it's very intense, or perhaps 2030. And you're going to see the water come in soon from essentially around AutoZone, start flying into the parking lot, starting at McDonald's. Then it's going to spread into the parking lot. And there's an actual computer animation, a very accurate one, put together by a company called RPS, using data from a company called Woods Hole Group. And now the waters are starting to flood into the parking lot. So the parking lot is now flooded. Water is increasing a little bit in height. Now soon it's going to spread into the Central Square area. But this again, another view of the parking lot being flooded. There you can see Central Square, and the park is actually not flooded, but all the area around it is flooded. And then the water is going to travel down Porter Street towards the tunnels, the Callahan and Sumner tunnels, which are one of the lifelines of East Boston to Boston. And essentially, this is a view of Meridian Street and Harbor Street overlooking the tunnels. And of course, because the tunnels are underground, soon you'll see the water flowing into the tunnels. Again, this is extremely accurate simulation, animation of the sort of flooding and the impacts that flooding we might see in Boston by 2030 if a major storm struck, or could even see this year if a very, very, very extreme storm struck Boston at full force. And of course, these images show the flooding that would occur if no measures are taken to manage the flooding. So one of the strategies that Mass DOT is going to take is to put gates over these tunnel entrances, stop the floodwaters to going through. But of course, during the storm and before the storm, just after the storm, these tunnels would have to be shut down. And of course, the T would be shut down as well, because even if Maverick Station didn't flood, Aquarium Station might be flooding and other elements of the blue line. Now the storm is receding, and again, aerial view of the tunnel area on Harbor Street and Meridian. Now I'm going to talk a little bit about how we can manage this flooding. So in fall, last fall, a group of residents in East Boston met with myself and landscape architect and engineering company to talk about how to prevent the flooding along Lower Border Street. And they came up with this plan. And the plan includes, first of all, 30 to 40% affordable housing, any new residential development along the Border Street, Liberty Plaza area. You can also see that it has a harbor walk there, that it would be, and parks in front. So you see this area here, the harbor walk elevates the land, so to stop the floodwaters, but the parks in front and the other aspects of this plan provide all sorts of amenities to the community, like parks, playing fields, community gardens, and meeting places. Of course, while waiting for this plan to be implemented and built, we need to have emergency preparedness plans. And that's really what this workshop is about. So now I'm going to turn this back to David, who's going to take us to the next segment of this. Again, thank you for your attention.
Thank you very much, Paul. I think the appropriate scientific response to that video simulation is yikes. That was pretty scary to see. And what we're going to do now, we've seen the consequences of a simulated 100-year flood in East Boston. But disasters are unpredictable. And what we'd like to consider now is what might happen if an even more catastrophic event struck East Boston. The tabletop exercise that we're about to engage in is designed to stretch our imaginations and to think about a worst-case scenario for East Boston. The key to these type of disaster scenarios is to consider what is plausible, even though it seems unlikely. The objective of the exercise is not to develop an accurate predictive model for forecasting an extreme storm, but rather to visualize the range of consequences that could occur and to imagine the ways that the community could and should respond to such an event. While we have tried to be faithful to all the scientific climate models, we have also assumed that the worst may still occur. Among the defining features of disasters is how variable the consequences are and how surprising they are to us. Superstorm Sandy, for example, flooded Lower Manhattan with a 14-foot storm tide with 9 feet of storm surge. That was much higher than expected and represented a 400-year storm. Poor planning for a disaster often reflects a failure of imagination. As you could see in these images here, disasters often take us by surprise. These are pictures from Hurricane Harvey. These are from Puerto Rico after Maria. These are Superstorm Sandy. And then among the largest storms, Hurricane Katrina, this is the lower Ninth Ward. These are often beyond what we can imagine. So our objectives with this scenario are twofold. One, to consider what the needs of the residents in East Boston will be after a catastrophic extreme weather event. And two, to consider how the community could and should respond. We also want to reinforce that there are two types of response to such disasters. There's going to be a formal response from agencies with federal, state, and local governments, including Boston's first responders, the Office of Emergency Management, the Boston Public Health Commission, and others. But there's also going to be an informal response of neighbors helping neighbors, of community organizations and businesses pivoting swiftly to address the needs of residents, and of voluntary and faith-based organizations rushing in to help. Our scenario is mainly going to focus on the latter, the community response. And although we will try to keep in mind the context of the formal response, we do want you to think about how the community will be likely to respond. A couple of rules before we put you into the breakout rooms. Number one, when you play in this scenario, you should be who you are. So represent who you are in your current role, whether you're a community resident, whether you're a member of a voluntary organization, whether you lead a local community or business, or whether you play multiple roles. Be who you are. Number two, all voices should be respected. So no one voice is more important than another. Number three, don't quibble with the small details. You may take issue with some of the assumptions that we have given you for this scenario that I'm about to describe, but look at the bigger picture. And keep in mind, lastly, that even though there may be local first responders or emergency managers in the breakout room with you, don't rely upon somebody else to tell you what will happen. We really want to know how the community will respond. So here's your situation. It is late October 2030, about a decade from now, when Hurricane Reynaldo makes landfall as a Category 3 hurricane at Chatham, and then a few hours later as a Category 4 hurricane at East Boston. There are sustained winds in excess of 130 miles an hour that are recorded at Logan International Airport. Just like Sandy happened in New York in 2012, Reynaldo took a left-hand turn from the Atlantic Ocean into what many people thought was a protected metropolitan harbor. And like Sandy, Reynaldo hit the area at high tide and full moon. The tides and storm surge combined brought waters rushing into East Boston waterfront at 12 feet above mean sea level. Reynaldo was recorded as the most ferocious storm to hit the area since the Great New England Hurricane of 1938. The water swept through the low-lying streets of East Boston. Blue Line service had been suspended in the hours before landfall, and it remained out of service for a week because of flooding at the Aquarium Station. As happened with many businesses in the area, the first floor of the East Boston Neighborhood Health Center in Maverick Square was destroyed. Glass windows broken from windswept debris. The health center's electronic medical record system is offline and inaccessible. The deepest flood line, with waters up to 2 to 4 feet in spots, extended from the East Pier straight up Bremen and Chelsea streets, past the courts, past the Y, all the way up to the public library and Day Square. Some of the deepest flooding was in Liberty Plaza, right by the community's only supermarket. One of the oil tanks near Chelsea Street Bridge was rumored to have leaked, and there is a concern that the standing water from the Chelsea Creek overflow may have been contaminated with oil. Similar concerns have arisen about toxins released at the Charlestown and Jeffreys Point boatyards, which could include waste paint, fiberglass, epoxy resins, etc., into Chelsea Creek and the floodwaters entering Jeffreys Point. There's a concern about contaminated soil in Piers 1 Park, and more generally about toxins released from household debris in the standing floodwaters around East Boston. Despite mandatory evacuation orders, a number of East Boston residents elected to stay in their homes. It's unknown how many people remained in the community. Even if people had stockpiled food and water to last 3 days, this extended disaster will quickly deplete those supplies. So let's get to where we are right now. So you've heard that it struck as a Cat 4 hurricane with these winds. And now what you need to know is that 1 week after the hurricane struck, 1 week after, there is no electricity in approximately 80% of households and businesses. The gas pumps are not working, ATMs are not working, fuel for generators is in very short supply, traffic lights are not working. Some of the natural gas lines have been disrupted. There is no heat and no hot water to approximately 30% of residential buildings, and this includes the Maverick Landing subsidized housing, Heritage Apartments, and Victory Gardens, which are both subsidized and senior housing. Since the storm, which happened in October, daytime temperatures have been dropping to the high 40s and 50s and nighttime in the low 40s. There is a concern about a nighttime frost and the potential to lead to frozen and burst pipes. Stores and markets remain boarded up, destroyed, or closed. There are very few markets selling food. FEMA and the Red Cross have set up distribution points for water and food, but these distribution sites are far from the neighborhoods, either too far to walk or people do not have cars or gas. Transportation is coming back haltingly. The Sumner and Callahan tunnels were flooded. Buses are not operating. Blue Line is not operating. At best, there may be limited ferry service at Lopresti Park to pick up some of the slack. Supply chain and electrical interruptions are affecting many, many aspects of life in the community. Pharmacies and their abilities to stock medicine. Dialysis centers, which are closed. There are a couple of mobile dialysis units going through the neighborhood, but it's unclear when and where they show up. Addiction therapy has been suspended, including methadone maintenance and opioid treatment. Home healthcare providers cannot access their clients. Electrical dependent and oxygen dependent households and homebounds are still believed to be living in the community. Most food pantries and shelters, including domestic abuse shelters, were closed because they could not operate safely. There are 2 large mass care shelters in the community. The 190-bed Don Orion nursing home has an emergency generator, but has limited fuel supply. It can only power critical infrastructure. 3 residents of the nursing home have died since the storm, and the local funeral homes have not been able to remove the bodies yet. The refrigeration unit that holds the bodies is being powered by the generator, but that comes at the expense of most lighting and television throughout the building. There are also staffing shortages at the nursing home, with most of the nursing and support staff having been at the home since before the storm. The National Guard has been activated, and there are many federal agencies circulating throughout the community. Because of the electrical disruptions, there is very limited internet, limited data availability, and some cell towers are not operational. All the schools and daycare centers are closed. It is pretty grim, the picture I've just painted. It looks a lot like parts of New York City looked in the week after Sandy. This is entirely plausible. With that, I'm going to be breaking everybody out into breakout rooms now. And when you go into the room, there will be a facilitator and a note taker. And they've got a series of questions that they're going to ask you. The first breakout room, we're going to take about 20 minutes to work through these questions. We're going to come back after that and talk about it. And then after that, we're going to have a second breakout room with all the same people in the room with you, and then come back and talk about that. So with that, I'm going to ask our video production team to send everybody into their breakout rooms. Good luck. Welcome back, everybody. Thank you for participating in breakout room number 1. Judging from, we were actually able to keep track in live fashion of what the note takers in your room were jotting down as you were saying it. So we were trying to monitor this. There was a small group of us that included Phil from NOAA, Alexis Merdjanoff, my colleague at NYU, and we had Deputy Rorie and Ky'ron Owens from OEM in a separate breakout room monitoring what you all were saying. So I'm going to now try to very quickly summarize some of the high points of what I saw. And I want to actually, before I highlight what you said, among the things that we were talking about in terms of what will the formal response be or what could it be, there will be an emergency operations center that the city of Boston will obviously set up to handle this event, and that emergency management center, emergency operations center will be coordinating with other emergency operating centers like the states, and if there's going to be a regional one, if this is a large enough storm, which this is likely to be. And in the local emergency operations center, there will be a liaison from the Office of Neighborhood Services that will probably be working to coordinate information from the communities to pass through to the formal emergency response entities that sit around the table of the Emergency Operations Center. Another thing that we talked about in terms of the formal response was going to be the critical importance of radios. Obviously, one of the challenges that I've presented to you is that communications are down for the most part, very limited. But one thing that is not down is radios. So if you had a transistor radio, you had batteries, you'd be able to hear some of the, the local information, and it would be a trusted source. After Hurricane Micael or Maria, I can't remember which one, in 2017 in the Virgin Islands, the governor of the US Virgin Islands made a habit of every night at 6 p.m. going on the radio and doing a situational report and update. And it was a very helpful, useful thing for the community. So here's what you all said were some of the answers to your questions. Who's going to be affected most and where are they? So obviously a lot of the groups focused on the elders and on families with kids, particularly small kids. Many of you focused on those who are disabled, particularly those with cognitive or mental disorders. You talked about people in institutional settings like nursing homes and one specific residence, the Wrightville Senior Residence Inn. You talked about people who were hospitalized, people who had language barriers, and people who were poor and homeless, all as being high need communities that are probably going to need immediate assistance during this phase. Some of you mentioned the fact that there need to be a number of boats available to respond. In our room, Deputy Rorie and Ky'ron Owens were mentioning that there will be fleets of boats from the Coast Guard, the Boston Fire Department, the Boston Police Department, and the Massachusetts State Police that would likely be available. And one can imagine that there will be private boats that will be coming in from volunteers. Down south, with some of the recent storms, there were a lot of stories about the Cajun Navy, which is just local boaters coming in to help rescue people, and it's entirely possible that we would see that in East Boston. When we were asking you about how do you prioritize the needs, one person actually mentioned something that had not even occurred to me, which is that the sewers will not be functioning properly. And there could be a lot of backup at sewers. And so that's also going to be an issue of just even getting through the streets. People looked to both BPHC, the Public Health Commission, and to the East Neighborhood Health Center, East Boston Neighborhood Health Center, as trusted entities and being entities that would be trusted also to prioritize. Generally, when we were asking about who is trusted, people said people in uniform, City Hall, community activists and leaders, community organizations acting as information brokers, which I think is going to be really critical and something that I'm going to want you to think about in the next breakout activity. And then the need for face-to-face communications to occur. How to share information. I was grateful to see at least one person said that the network map that we presented before would be a good place to start. And I would agree that one thing to think about is what are the pathways of communication that happen right now in the community. We're going to be asking you about that essentially in the next breakout. And how can you take what is the strength of the community right now in East Boston and begin to project it on into the response entity. Before I break you up, are there into the next breakout session, are there any questions that anybody wants to put in the chat or comments? I'll at least entertain that for a moment. Excuse me. So if anybody has any comments or questions that they want to put in the chat, we could do that for 1 or 2 minutes. If I don't see any in the next moment or so, we're going to go back to the breakout rooms, the same rooms for a shorter period of time. That was already pretty short. Now I'm going to give you all 15 minutes to think about what can community organizations do. There will be a series of questions that your facilitators will pose to you, and we'll see what you come up with next. I am going to, at the end of this, we're going to clean up the notes that are taken from all of these rooms, and we'll put that as part of the resources that we share after the event. So keep in mind, if you haven't registered, don't forget to register for the event at the link that you see. And that way we'll be able to share a report back to you. So at this point, Josh, if you could please put everyone in their breakout rooms again, and we'll see you in 15 minutes. Welcome back, everybody. Thank you for a very short and eclipsed time of addressing so many questions. We were following the list of responses, and it was extraordinary to see how much people were talking about. So here are a couple of the highlights that we've picked up from your breakout room activity. And the first one is important to note is that Deputy Rorie from OEM noted, as he was reading through a lot of the responses as well, how highly reliant OEM is on community organizations, community leaders, communicating directly to the emergency management entities to make sure that it's understood who is in the most need and where are they. So in looking at the questions about what kind of models there are and what kind of existing structures there are in the community that could be leveraged and used, there was a lot of discussion about that. And it looked at some of the things that people wrote is a lot of people know each other in the neighborhood. So you just need some sort of way to connect them, as if there was a mechanism, a platform, an organization, a partnership, a collaborative. This is something that we're going to talk about in a few minutes. Is it possible to envision that kind of an entity to connect people? Others said that there are a lot of existing networks in the community that can be utilized and capitalized upon. Some people noted that there's almost a Venn diagram of overlapping networks of community and government organizations. And that, by the way, is borne out by the network analysis that we've done and that Alexis reported on earlier. One person said there's a need for a neutral organization to be this entity that might serve to link people together. Other folks said that it would help to have the higher ground organizations who may be less impacted by the immediate flooding to step forward and be able to take the lead on a lot of activity. There was at least one person who noted a concern that in a time of scarce resources, it's possible that local leaders, at least this was their concern, or the perception that local leaders might take care of themselves and their families first. So obviously there would be an issue of trust that would be an important one for people to address. When we asked about what are the best coordination mechanisms, a lot of people talked about the Emergency Operations Center, which is the formal coordination mechanism that will be run by Boston Office of Emergency Management, looking to the legitimate organizations that already exist in the community. People mentioned East Boston Neighborhood Health and the Boston Public Health Commission by name. Some folks referenced the Chelsea Food Network that has arisen particularly recently, and I think Phil may speak to that in a moment as well. And then around the question of the undocumented, there were a number of responses to that, most of which prefaced it by saying that people who are undocumented tend to be very protected in Massachusetts, that the people in East Boston tend to be very tolerant. They don't care about documentation. But some did note that during COVID-19, those who are undocumented were unwilling to step forward and apply for benefits that they would otherwise be eligible for. So those were some of the highlights that I noted. I would ask whether any of my co-panelists from the breakout room, Alexis, Phil, Deputy Rorie, if you had anything that you wanted to add to that before we move to what is essentially the final discussion.
I think I might, and I picked this up from Deputy Rorie, who could speak more to it, but any event that affects East Boston in this manner will also be affecting other parts of the city, low-lying neighborhoods. So certainly South Boston, the North End will be affected. Lots of people will be calling for attention in lots of different places. And I think David said this was what happened after events he's seen, Hurricane Katrina, where one doesn't expect these things. All of a sudden it's then worse than we've planned for. So we can't expect everybody to helicopter in and then save us. I think some of the comments people were making earlier about we know each other, how do we help our neighbors? We heard some of these comments from Rich Serino, like it's the whole community approach. So how do we develop that? How do we move to that? I think is important. More later.
Great. And I see at least one person noted to me privately on a direct message that the Massachusetts VOAD, the voluntary organized for disasters, is and can be the neutral organization to help. So that certainly is a possibility. So at this point, Deputy Rorie, did you have anything that you wanted to add to this before we moved on?
No.
Okay. So Phil, I'm actually going to turn it over to you to take us through maybe a consideration of what are the opportunities for action that present themselves to us now at the end of this assembly.
Well, thank you, David, and hope other people have some suggestions. I have one suggestion for action, and that is, I meant to mention this earlier, that we usually, when we do these events, we serve food and refreshments so people can be refreshed. We didn't do that today, but for the 60 people or so who remain and the others who attended, Noah's going to make this offer and give you a little bit of lunch, if not today, then during the next week. So you can go to one of three places. You can go to Americano and get your cup of coffee or latte like I did before you start. David knows you're coming and he'll put it on a list. You can go to Meridian Market and say, I'm from the Resilience Assembly, and Phil said I could come down here and get a sandwich. So you can do that in the next week. And if you prefer Hacienda, which some of us do, maybe you can go to both places. We'll have to check. Anyway, we'll send you to Hacienda. You go to talk to Jose or family, get a list and get a pupusa or anything you want for lunch too. So we'll hold that out for you or anybody else who wants it. So you can't have your lunch today on us, but you can during the course of the next week. We're not going to see you order your Thanksgiving dinner from Meridian Market, but you can get a cup of coffee, a donut, or whatever you want from these great food establishments. And I think it does come back to, you know, these are people we know. We know them pretty well, actually. And I think they're part of our network. We did hear somebody say small business earlier. I don't know. I don't think Gladys or Jim Kearney from Gladys from Main Streets or Jim were on today. But we do talk with them frequently about sharing resources and being part of the neighborhood and part of the network. I'm more in touch with Jim on sort of the greenscape, the hardscape stuff going on in we want to have happen in Central Square, or prevent what we saw from potentially happening in Maverick Square. Gladys, I know, does her own food network, does a lot of active work with the neighborhood as well. So these are very active people in the community, which I think with East Boston is already blessed. Opportunities for action. Some of the things we were talking about are, how do we continue to educate people about the resources that exist? Certainly most people know, I think, about the quality and the reach of the health center, but maybe there are some who don't, but we want to keep the health center in the center of our preparedness universe here. I think we want to continue to how to work together. I do know that, you know, when Alexis showed that distribution map, which would look like the Milky Way, actually, in another way, Alexis, you know, that's we are connected. We know a lot of people. I think languages in the old days, as Robert Schmidt will remember, you knew one family, you knew 50 people, 60 people, 80 people. It went that way. Now there are different levels because there are cultures and languages and whatnot. So we know each other, but we don't know each other as well as we might. So we want to continue to build cohesion, social capital, build leaders. And we want everybody, I think, to become, as much as they can, a leader of how they organize themselves. I think David has a term for it. I'll let him try to explain it later when we picked it up. We want to talk about, maybe, is there a resilience network, frankly, that we should be developing in the neighborhood? And I do think we've done some great work. And I think, as Sandra and I think Rita's on notes, that where there's been a fabulous response built from the ground up after the pandemic. And there's food insecurity, which is going to remain. I think we want to talk about in the next couple of weeks how we have a food summit in the neighborhood that might build into resilience. So is there a resilience network that we want to connect? We know now, and we have more contact with Ky'ron and OEM. We know Nancy, if she were still here, I can just feel her embrace. She's fabulous. She makes you feel better when you get near her because she's always there for you. So Nancy, Public Health Commission, OEM, those are networks that are going to, when a disaster comes, and we know it isn't going to happen just like that, we're going to get some notice something is coming. How do we connect these entities so that we're all a part of this? And one of the things we're hearing, how do we get information out to our network so they can prepare? If they don't have their documents ready, get them ready. If you don't have your flashlight ready, Sandra's going to go give it to you. You know what I mean? If you don't know what's going on at Maverick Landing, Bob's going to go knock on your door and tell you what's happening, I think. Right, guys? So those kind of things we need to build in with each other in the neighborhood. They're already great. I feel very proud the neighborhood has picked up since the pandemic with the food response, but things are going to get worse again for a couple of months till we tackle this, and wear your mask again. So once you leave here, Michael, put your mask on, give us a good example. And we have our own, we may have a few left if you want to know one. Anyway, working together, preparedness, learning more about, nature, climate change, all the threats that are coming our way. Again, now that science is back in the White House shortly, a couple of months, I'm counting the days, maybe it's 70, we'll learn more about what actually happens. We'll be able to work with, you'll get more resources. I think more might be coming from Washington down to the state, down to the health centers and others, not being too political about it, but I think we want to teach people more about science and what can happen here. I want to thank Paul again for getting his team together to share that rather dramatic video. Not that we want to see that happen. We never want to see that happen. But things could happen, as we said. So again, I just want to say, I think that their possible next step is, what kind of resilience network could we build? I could have a couple of things in mind, or a couple of people or groups. It doesn't have to be at NOAA. Like I've said in the ads, we're not looking to sort of save the neighborhood. We can't do that. We're one part of the neighborhood. We have our role. We know what that is. We want to work on infrastructure. We want to tell people what's going on. We want to work on resiliency personally and as a community, and knit people together. So that's our role. We would help seed fund some of that kind of stuff. And happy to work with some of the existing networks like the Social Center, the Health Center, and others, and the Food Security Network that's already doing this kind of thing. So I think we have a basis that I'm very proud of for being East Boston, have learned a lot, we'll continue to learn a lot. We know a lot of people, we're connected in lots of ways already. I think we can tighten it up a little bit more in terms of COVID coming. Michael and Jackie on here, I think you guys have done a really good job informing the neighborhood. I know there's a network. Maybe we enlarge that network somehow so that we all get the information out and support each other during these next, the words are a very dark winter ahead. Anyway, we want to make it as palatable as possible. It's not going to be easy. So those are the kind of things I'm thinking about. The Resilience Network, informing people, being bilingual, bicultural about it. I think we have a network that reaches out. More could always be done, of course, that kind of thing. But I think we're all moving in the right direction on some of these things. A little bit to tighten up. We know each other well. No reason why we shouldn't have a high level of trust and move things forward. Those are some of my comments and observations. David, I'll turn it back to you.
Great. Thank you very much, Phil. One of the things that Rich Serino talked about in his plenary discussion was what happened in Joplin, Missouri after this enormous tornado. I actually had the opportunity to go down to Joplin and do a case study of how that community responded. And in some ways, it reminds me a lot of East Boston. There was a community of about 50,000 people who lived in Joplin, again, about the same size as East Boston, plus or minus, with a great deal of community cohesion among different organizations. And I think that's really the name of the game here that we're really trying to get to, is collective effort or collective efficacy of the community, not just in this really stressful moment of the disaster that I gave you to think about, but even in thinking about how can you adapt and mitigate to climate change, and thinking about the kinds of practices that have to be put into place. And so what we'd like to do for this very last segment is ask a few of our participants to reflect on one question, and I'm going to ask Nancy Smith, Micael Mancusi, or Jackie Fantes from the East Boston Neighborhood Health Center. If Sanjay Seth is here from the City of Boston, the city's resilience manager, and Deputy Rorie, I would ask them to maybe give some thought to this question, which is, what can the community do together, and how should we be organizing those activities? Is there some mechanism that you can think of that would work to bring people together? I mean, Phil has talked about an East Boston Resilience Network, something that we've begun thinking about, and I'm curious to hear if any of you have any thoughts about what that might look like and what that could be. So let me start by asking Nancy. I'll put you on the spot. I hope you don't mind. If you're still here, would you entertain that question for a moment?
I first think that East Boston, and actually all of the city of Boston, which allows us to have that whole community thought process. We've seen what took place where communities took care of themselves. They were forced to do it. And a lot of them thought that they had not had training for it, but they did it, and they did it very well. And so at our organization, the Boston Public Health Convention, we have what is called the Devalier program. It's a center. We have online classes that organizations can take. We have courses that neighborhood individuals can take online, especially even right now. We have a couple of courses that are coming up. I think I'll put the links and send it for people to strengthen what they're doing already. But I think one of the things is to be flexible and to know that you've done this amazing job, amazing community MOUs, that no paperwork was done. I've been very fascinated and very in awe with all of the neighborhoods and how successful they have done this work during the pandemic. And so I think going forward is just to continue to the group that we're in. One of the challenges is if we have more private organizations. When people were talking about those kits, we talk about those first aid kits all the time, the go bags. There's ways that you can get radios out to neighborhoods, take some funding, provide so many streets per year with crank radios. The next year, go to another set of streets. There's a lot of things that you can do with funding for these, especially like some of the banks. Instead of giving out like pens and paper and all that stuff like that, really look at those private organizations to take their funding and buy something that is useful for those households and drill it all the way down. And that's all I have to say.
Okay. Thank you very much, Nancy. And Micael, if I could put the spotlight on you for a second, and maybe think about, what are the mechanisms that you can envision in the community to address some of these resilience building ideas that we've been talking about today?
Well, I appreciate the opportunity, David. I would just say very briefly, I love the idea of an East Boston Resilience Network, because I do think we have the beginnings of the infrastructure for such a thing. If I think across what we've been doing for the last couple of years pre-COVID, when we've tried to pull together this community health initiative, realizing the major partnerships we have and the major organizations we have are all doing, say, food distribution and other things, that if we pulled our resources together, we could achieve so much more. So that plus, we do through funding through the city have the neighborhood trauma team and our hub model. And through all those mechanisms, those are just beginning to build the infrastructure that could contribute, if we expanded it to all the grassroots organizations, resilience network. And I'll just add one more thing, which is of course, as a behavioral health provider, I think about psychological first aid and how much of that is going to be needed. So training together on things like that and expanding our knowledge of ICS is one of the things that Eric Olson was talking about. So if we had this resilience network, we could go bottom to top with these things.
Great, thank you. And ICS is the incident command structure that is what is used across many different levels of government and first response to organize activities.
Yes, and we have it as organizations, but that's in our organization. We need it for the community.
Right, and perhaps the East Boston Resilience Network could serve as that ICS structure for the community to interact between formal and informal response entities. Deputy Rorie, I'm wondering if you would be willing to entertain that question of the ways to make the connections between those formal and informal response efforts in a community and something like an East Boston Resilience Network.
Making community lifelines, a core focus of incident response within a community, offer unique benefits for incidents ranging from small scale to catastrophic disasters. And it helps the community stabilize and get back to being whole. So I think that, staying in communication with all of these various entities that are working here today is the best way for us to move forward in helping a community like East Boston, South Boston, those communities that are directly can be impacted by in a scenario in which, we work today is the best way for us to move forward and to get more information to those neighborhoods on where the help is and how they can access that help. If that answers your question.
It does. Well, thank you for that. So Phil, at this point, I think I'm going to turn it back to you after having heard and having had us discuss the option perhaps of an East Boston Resilience Network. Perhaps you can offer some ideas as to what next steps we might all think about.
Well, again, thank you for that, David. I know some of us through the Social Center and Gloria Divine meet occasionally by Zoom and that kind of thing. And some of us have begun, I think Sandra and others have talked about a little bit about maybe having a food summit so we can think about what happens in the winter. Manlio on our staff has done fabulous work. If you don't know him, it'd be a pleasure to meet him sometime. So, what that means is we've all been doing this a lot of outdoors since the weather was March 13th. It got warmer now. It's not March 13th, it's November something. And so where will people be able to go now that fresh food can't be distributed outside very often? Yet we now have to definitely social distance, wear the mask, hand sanitizer, can't congregate. Is there a larger place or two where we can call upon city, state, fed, the USDA resources and distribute food, culturally appropriate food and that kind of thing? Anyway, we might meet. I think we're meeting this Wednesday. That may be a place where we can begin a discussion. I'm glad to hear Micael talk about the possibility of some further work at the health initiative they've begun, and we know that they're up at the old library in East Boston. So again, a couple of nodes are already doing this and our own little networks that I think I saw John walking here. I think there are networks that we all have out there in the neighborhood that we talk to people on Eagle Hill and other places, Chelsea Creek, Orient Heights for sure, that people are networked and talking with each other. So I think we can tighten that up a little bit. and go forward. So I'd offer that as a possibility. We can carry this forward as NOAA for a while. Happy to be part of it, happy to begin to pull people together, keep that kind of thing going, keep the conversation going on that. I'd be remiss if I didn't, because I could easily forget. I think, no, we put a fabulous team here together. So again, I want to thank David, Alexis, Robbin. I don't have the full gallery screen, so I'm going to forget, but I know Linda's here. Melinda's behind the scenes. Manliel's still here. Nancy, Ky'ron, Jackie, I think I saw you still there. Fabulous team, and Joshua, the I-team. Spinach pie, I don't know where that came from. I love spinach pie too. But you did a great job pulling this all together. It's just an easy Zoom to do this and then say thank you when it's all done. A lot of participation. You've hung in there for a long time. And again, I did offer that food. So if you don't take advantage of it in the next week, you're remiss in doing that. And if Nancy, you need something, or Ky'ron from a distance, we'll get that over to you at some point too. So my last words are thank you for helping us do this in East Boston. We will be in touch with you. We didn't, if you want to make any suggestions, I think you have my email or the chat room, a phone call. We do want to hear about, we didn't do this right, we forgot those people, we always do, but that's nothing intentionally. So please share with us your thoughts about anything we have here going forward. So we're really grateful to have been able to participate in this with you. I would say in the hardscape, greenscape side that you saw when Dr. Paul Kirshen presented that, NOAA does do that work. That's not the same work. That's a different kind of resilience on the other side. It can get messy out there that way too. But we don't want to see that video in East Boston. We want to see pictures. We don't want to see that on Channel 5 and all the other stations. We want to prevent that. So we want to see as the neighborhood pull together in a variety of ways and build up the neighborhood, and to be discussed ways of building green, affordable housing, access, density, let the owners get some cash, who's going to have to out of that, how to pull the city and state and the feds together to build resilience along the waterfront in whatever form it takes. But we need to do it soon, because 2030, it's right around the corner. With that, David, I'm going to say thank you. Maybe turn it back to you or Joshua for a last comment. But again, welcome everybody. Thank you very much for joining us on this day for such a long period of time. Been great to see you.
Great. Thank you, Phil. And I think all I'm going to echo is thank you. And I hope everybody has a great day.